The Center for Disease Control estimates that over half of people in the U.S. will struggle with a mental health concern at some point in their lives. For participants on UT Select and UT Connect, you have access to several programs to help you deal with mental health challenges of any kind and severity. Depending on many factors like your behavioral health concerns, your available time, and personal preferences, some services may fit your needs better than others. We invite you to explore the options and find what works best for you. About the behavioral health programs. First, the programs use the terms behavioral health and mental health when describing their services. We will use the phrases interchangeably throughout this video. Next, you do not need a physician's referral for any of these options. Finally, while these programs are offered through your employer-sponsored health coverage, your employer will not be told that you're accessing mental health services or know what you've discussed with your mental health provider. We would now like to introduce you to the mental health programs available to you. Learn to Live, MD Live, the Employee Assistance Program, and Traditional Behavioral Health Services. Learn to Live. Learn to Live is a new addition to your medical plan as of 2022. It offers 5 self-paced online courses you can do anytime, anywhere. Built on the principles of CBT, or Cognitive Behavioral Therapy, the courses help people learn to understand and overcome their challenging thoughts and feelings. On the Learn to Live website, you can start with an optional short assessment that suggests courses for you, or you can jump right into your preferred course. The topics are depression, stress, anxiety, and worry, social anxiety, insomnia, and substance use. Each course consists of 8 digital lessons and includes quizzes, videos, trackers, and homework to practice what you've learned. You can complete the courses by yourself or enlist the support of a coach or teammates. A coach offers one-on-one support while you're going through the program. They are trained professionals available to cheer you on and help you master your new skills via phone, text, or email. You can also select up to 2 people, called teammates, to encourage you on your journey. Learn to Live is available to all members ages 13 and up in English and Spanish. The program is free to use, and you can take as many courses as you'd like. Access Learn to Live by logging into Blue Access for Members, choosing the Wellness tab, and clicking on Learn to Live. Alternately, you can visit learntolive.com/welcome/BCBSTX and enter the access code BETTERME. You'll then be prompted to enter your benefits ID number. Employee Assistance Program. Your Employee Assistance Program, or EAP for short, is available when you experience problems affecting your personal life, relationships, or job. It offers short-term counseling, consultations, and referral services. Every UT System institution has an employee assistance program, and UT System administration employees can access UT Austin's EAP. The staff at your EAP are professionals trained to support you through a wide variety of issues people face. Among the many concerns they assist with are depression and anxiety, stress and burnout, suicidal ideation, substance use, marital, family, and relationship issues, and workplace conflict or concerns. All services offered through your EAP are confidential. They are also available at no charge. Based on your needs, your EAP may refer you to other community resources, which could have costs like insurance copays or deductibles. Each institution's EAP has its specific hours, appointment and telephone counseling options, and criteria for who is eligible to receive services. Find details and contact information for your institution at utbenefits.link/EAP. MD Live. MD Live offers phone and virtual behavioral health visits from your home or wherever you are most comfortable. You may work with a therapist for talk therapy and strategy sessions, or you can connect with a psychiatrist for assessment and medication management. They are available for many concerns like addictions, eating disorders, grief and loss, phobias, and stress management. MD Live is available to members ages 11 and up via appointment, including on nights and weekends. On average, you can book behavioral health appointments about 5 to 7 days after requesting a session, depending on your needs and the provider you choose. In addition, for participants who are deaf or hard of hearing, the platform offers a secure HIPAA-compliant live chat feature on their website. Appointments are free to plan members, and there's no limit on the number of times you may see providers through the platform. If your provider prescribes any medications during your session, the standard cost of prescriptions applies. For more information about MD Live's options, visit mdlive.com/bcbstx. Traditional behavioral health services. Traditional behavioral health services include in-person and telemedicine office visits, outpatient services, and inpatient programs. Services are provided by therapists, psychiatrists, and other mental health professionals. Costs are based on applicable copays, coinsurance, and deductibles. All members are eligible for these services with no age requirements. To locate a provider that speaks your preferred language, you can contact a health advocate, customer service, or consult the online provider finder directory. UT Select members can find a summary of benefits chart in your plan guide at utbenefits.link/UT-Select-Guide, or call your health advocate at 866-882-2034. All inpatient and some outpatient services require pre-authorization, and you can contact the number above to be routed to the appropriate area for prior authorization. Like other health services, you save money when visiting in-network providers and facilities. UT Select members can refer to the Know Your Behavioral Health Network flyer found at utbenefits.link/BHNetwork for examples of cost savings by staying within the network. UT Connect members can find a summary of benefits in your plan guide at utbenefits.link/UT-Connect-Guide, or call customer service at 888-399-8889. Inpatient services and certain outpatient services can be pre-authorized by calling the Behavioral Health Helpline 24 hours a day at 800-729-2422. Throughout this video, you learned about the programs available to assist with your behavioral health concerns. You can find additional information on the UT Benefits Living Well website at utbenefits.link/livingwell. On there, the Stress Less tab offers links to many of the services listed above, plus self-care resources. On behalf of UT Benefits, we hope these offerings serve you well.